Right now, Denver City Council is still discussing whether to increase access for needle exchange programs in the city. City Council is considering lifting the limit on how many providers can operate and getting rid of a ban on needle exchanges less than 1,000 feet from a school or daycare. Our Angeline McCall's been listening in on this debate, which continues. Angeline?
Yeah. Kyle, this has been a topic that's divided council and one the mayor has expressed his own hesitancy about. Right now, Denver has 3 needle exchange programs. One of them is mobile, 2 fixed locations where people can swap out dirty syringes for clean ones. One of those service providers needs to move, and they say they can't find a new location due to the restrictions that have been in place, in large part due to that 1,000-foot requirement from being from a school or daycare. The sponsors of the bill say overdose deaths have doubled since the pandemic when they were already high. They have data that suggests 7,000 people each month use these needle exchange sites, saying these numbers really show a need here in Denver. They also said that other cities don't have a cap on the number of services. Right now it's capped at 3, and that currently, Denver does not stand where other national cities do.
Look at this as another road to recovery. This is a way that people can access the services that they need when they need them, when they are ready. But it is also life-saving. This is life-saving.
Earlier this month, 4 council members voted against moving this ordinance forward. One of those voices of opposition, Councilmember Kevin Flynn, said he is in favor of keeping needle exchange services at a distance from schools and daycare, right now being that 1,000 feet. He also said that he would worry about the potential for those sites to become safe injection sites. Want to reiterate that this is where people are under the supervision of medical professionals. Right now, that is not something currently allowed. It is prohibited under Colorado law, but he said it's the possibility of the future that worries him.
I'm not interested in stigmatizing people who use drugs because it's an addiction, it's a disease. I'm not interested in stigmatizing them any more than they might already feel, but I'm also not interested in showcasing it. And I think when parents drop their kids off at a daycare, it would just be nice if it's 2 blocks away. 1,000 feet is basically 2 blocks.
We asked Mayor Johnson today his thoughts. He said in a statement through his spokesperson that we believe that there is an adequate supply of needle exchange programs to meet the current demands, adding that he will review the bill. No indication if that means he could potentially veto. Kyle.
And when we talk about those needle exchange programs, maybe someday being converted into what are known as supervised injection sites, some people call them safe injection sites, that would require legislative approval at the state level, for which there has not been the votes in recent years, and then a recommitment from City Council that they want to do it, and the mayor would have input there, and Mayor Johnson was very clear in the campaign, he's not interested.
Yeah, something that the sponsors of this ordinance change really talked about with me was that they would have to revisit this ordinance once again in the event that safe injection sites were ever allowed under Colorado law.
All right, and while we were talking, Angeline, it just passed 8 yeses, 5 noes, relatively narrow margin on council, so now it becomes a question for the mayor. Angeline McCall, thank you.